Hi, everyone. Just going to get going with some of the provincial data first in terms of COVID infections. As you may have heard, we're kind of teetering at the 150, 180 mark over the last couple of days. We've also had last week we had some cases up in the 200 range, but they've been generally at that level provincially. Ottawa had one yesterday. We had a couple over the weekend, and again, our case rates are low. We have no outbreaks. We have no hospitalizations at this point. Provincially, the numbers are also going down in terms of ICU admissions and hospitalizations. So that's good. We're again just monitoring that. We're obviously worried about Delta. We had one case of a Delta. There was a case in middle of July that came back as a Delta variant, but that didn't go anywhere. That didn't spread. It was one of our cases. I'm not sure which one it was. I can tell you that all the cases that we've had were not vaccinated, and over the last month or so. And again, that one Delta variant was retrospectively told to us because it takes about a week or two before they identify it at the central lab. But there was no other outbreaks related to that, so it was very good. It was kept in there because, as you know, this is a highly infectious form of this variant, and so that is good news. I'm going to spend most of the time now talking about vaccinations because vaccinations really is the way to go to be able to address as much as possible the COVID variant, particularly the Delta variant that we do know is responsive to 2 doses. And so I'm just going to go over sort of a weekly update of our vaccines and where we are in the Eastern Ontario Health Unit area. As of yesterday, we had vaccinated over 270,000 doses that include 146,230. First dose, which is almost at the 80% level. As you can see, we're missing barely 100 doses or something like that. And we're up to almost 124,000 second doses. Again, it represents 70% of the 18 plus, but almost 68% of our fully vaccinated. And the reason I stress those is because our foray beyond step 3 really depends on immunization levels. I have another slide here that's interesting as well, which shows us again uptake week to week. We're seeing an increased percentage of people with the first dose going slowly, particularly in the less than 30-year-olds. We're seeing now we're up to the 60% range. It took a while, but we're up there. Of course, we have more to go, but we can see that in the elderly, in the elder groups, we're up in the 90 range in second dose and approaching that in the lower age range as well, above 65. This is an interesting one here that shows us, again, gender-based, so female and male. And the reason I bring that up is for all intents and purposes, they're kind of the same in terms of male to female, but we tend to see less uptake in male versus female, particularly in certain age groups, particularly in the younger age groups. And so that's something that we'll be looking at as we go to what we call the last mile, that I will talk a bit about a bit later, which really is taking us from the step 3 kind of exit levels to a real what we feel will be a adequate protection, particularly versus the Delta variant. So just to give you an idea here, we vaccinated administered 73,000 doses last month. Again, that's a bit decreased. We have noticed over the last week of July a decrease in our clinics. I think people are on vacation, and I think we're anticipating that. And this is seen provincially as well. In terms of our first dose, again, we went up a couple of thousand doses from the previous week, and again, we're very close to that 80% mark, and I'll show you how close we are later. Again, we went up more. This week we went up among the highest, a 7% increase from the previous week in terms of our numbers of second doses. Which is good, and we still encourage the 140,000 odd people those other remaining to get their vaccine as soon as possible, and I will talk about those strategies. This is just looking at, again, what our goals are, and as I said, our first dose goal is 80%, which would represent 146,000. We're basically 170 doses away, so we'll easily get that. We're at the level now where we're really needing to push the second dose out. I would hope that at least least as many people that have had their first dose come and get their second dose. That'll bring us up to higher levels. Again, you can see that we're up to about 68%, and we're down. We're probably a week away from 75 or so. Certainly this week we will get to the 70% mark. The 70% mark is also an important one, because if the province reaches 75% globally, they want each health unit to be at least at 70%. But you can see that we're still about 13,000 doses away from that. So we really want to push this and try to get to that second dose level as quickly as we can. One of the things that I want to stress to everyone is that although we do have we're reaching those levels, those are levels for us to be able to go out of step 3 into really virtually no restrictions, with the exception of masking. And again, those are just for that phase. From the point of view of trying to protect as much as we can, the community in terms of herd immunity, we need to reach that 85-90% mark. And that's what we call the last mile. So you can see we're at the 80% mark now in terms of first dose. We'll get to the 80% dose at one point, second dose, but we want to go up. We want to push it up to 90%. And that's what we call that last mile, that 10%. And so we have multiple strategies. We're going to be winding down our mass immunization clinics towards the end of August, but we will be offering our clinics through our EOHU offices, our 6 offices. We'll be doing pop-up clinics, mobile clinics. I mean, whatever it takes to do so, working with the schools, working with everybody else. And we're encouraging people, again, if you're having second thoughts about getting your dose, please go ahead and do it, because that'll be a much better exit out of step 3 into a more normalcy. And for those of you who had their first dose and are due for the second dose, please, we're making it easy for you. You can go to the pharmacy, you can go to any one of our clinics, walk in without an appointment, or call in and get your appointment done earlier if you were given an appointment later on in the summer. So that, to me, that's a very important message, but I think we're getting there, and I think it just speaks to our population. We're really at that last mile now, and I think that we can see that that normalcy as we go into the fall months. And speaking of the fall months, we just, as you know, just today, as a matter of fact, I think at 2 o'clock or 3 o'clock this afternoon, the government released its COVID-19 health and safety operational guidance for schools. I took a very quick look at it, and basically it entails really similar. It's acting as if nobody's vaccinated, really, which I think is a good approach, because younger children are not going to be vaccinated by the time school starts. And so basically the premise is multiple layers of protection, which include screening, which include masking, grade 1 to 12, masking and protective equipment for all teachers, but virtually a return to normal activities, 5 days a week, 300 minutes a day, both to high school and to elementary school. There's some cohorting. The classes remain the same, teachers remain the same in elementary school, and there's some other cohorting and changes to high school, but they too will be going back to school 5 days a week. Of course, there's an option for parents if they want to have online learning, but it's quite important to say that kids need this face-to-face at school. So I'm very happy to see these. Of course, masking grade 1 to grade 12 for students. Under certain circumstances, they can remove them to eat and physical activities, and while they're outdoors, they don't need to wear masking. There are more details there, but there are layered. I like what they've done. They've bundled them up. It's all multi-layered approach. Obviously, which come from is screening, disinfection, and ventilation as well. Ventilation, I think, is important. There are multiple steps in there, and there'll be actually separate guidelines for that as well. But just to summarize, HVACs must be operational, must have high capacity filters, must be working 2 hours before school opens. Windows should be opened. If there is no mechanical ventilation, then they will put HEPA filters in each classroom, and 2 if required, where spaces are. So those things are all going to be taken, but those things should be a collective thing. What I'm also saying is vaccination. Obviously, they talk about vaccination, But vaccination to me is an important factor, particularly in high schools and particularly among teachers and staff in elementary schools, because that to me is that extra ring of protection. So when you're talking about protection in kids that are not vaccinated, we're affording them the indirect protection of having everybody around them hopefully vaccinated at high rates in the schools and at home with their older siblings and families. So I think that would be good. Moving forward, we are working with the school boards to, for example, because we're now at 60%. We want to push that number much higher. We will be working with the school boards to get an idea of what the percentage of vaccinated people are in the schools and teachers as well. It gives us an idea of how we can handle outbreaks or cases. And there will be some guidance and there will be some separate guidance, separate approaches versus an individual who contracts or has symptoms, and the follow-up in terms of contact tracing, isolation requirements and testing requirements will vary based on that individual's vaccination status. And that's how we're going to be moving forward in that regard. One of the things that is in the document, and we know very well after speaking with the Chief Medical Officer of Health, is that we will always reevaluate the need for masking, and depending on numbers, and let's say we vaccinate younger children in the fall or closer to the Christmas time, whenever a vaccine is available, we're always going to reevaluate, and there are always going to be the ability locally to modify, to add restrictions depending on local situations, of course. So that is where we are. Like I said, I had a quick look at it. Obviously, we'll be working with our school boards, with our staff and our school nurses to be able to support the schools as they move forward. Bonjour tout le monde, je vais commencer avec les chiffres antérieurs. On est rendu à 164 cas depuis le jour précédent et 168 depuis le jour précédent avant ça. Donc, on est stable au niveau entre 150 et 200. Donc, les cas sont stables. On n'a aucune augmentation au niveau d'hospitalisation à travers d'Ontario, ni aux soins intensifs. En effet, ça va en diminuant. Ottawa avait un cas. Nous, on a eu quelques cas pendant la fin de semaine. Pendant 4 jours, on a eu 2 cas. Il faut dire qu'on n'a aucune hospitalisation, aucune flambée dans notre région. Et aussi, on a eu un cas de Delta il y a à peu près un mois. Mais aucun autre cas a été relié à ça. Il faut dire aussi que parmi les cas qu'on avait depuis le dernier mois, tous les cas étaient non vaccinés. Donc ça veut dire qu'en effet, la pandémie est rendue une pandémie pour les non vaccinés. Donc c'est un message de se faire vacciner. Je vais maintenant parler des vaccins. Je veux vous démontrer où on est rendu cette semaine avec nos chiffres de vaccins. En effet, je vais commencer ici. Donc, ces temps-ci, à compter de hier, on a vacciné 270 000 personnes et vous voyez, on est rendu à 81,4% des adultes vaccinés première dose et presque 80% des personnes à 12 ans et plus. Et nous avons vacciné presque 124 000 personnes avec la deuxième dose, à peu près 70% des adultes et 68% à peu près s'approchent avec les personnes 12 ans et plus. Ça, c'est les chiffres importants parce que ça, c'est les ciblés, sont ciblés, je vais parler tantôt. On n'est pas là encore, mais on l'approche. Il faut dire qu'on a augmenté de 6,8 ou 7% depuis la semaine passée. Au niveau des pourcentages, on voit toujours que les personnes âgées ici, les personnes plus que 60 ans, ont un très bon pourcentage, soit la première dose, soit la deuxième dose. On voit ici pour les personnes en bas de 30 ans qu'on a encore la difficulté, mais ça va mieux. On voit une progression et on va commencer à travailler avec les écoles, avec d'autres personnes aussi pour qu'on puisse augmenter le taux de vaccination, surtout aux personnes à 30 ans et moins. Ici, on a les mêmes statistiques, mais au niveau des femmes versus les hommes, on voit qu'au niveau des hommes, surtout les jeunes hommes, on a les pourcentages moins chez les hommes que les femmes. Donc, ça, c'est une chose pour nous importante quand on va cibler pour aller voir les personnes qui sont hésitantes. Ça nous donne aussi, on a vacciné à peu près 73 000 en total en mois de juillet. C'est un peu moins qu'en mois de juin, mais on a remarqué qu'avec les vacances, tout ça, on avait moins de personnes qui sont présentées à nos cliniques et on commence au mois d'août. On voit ici encore, on est rendu à 146 000 premières doses et on approche le 80 % pour 12 ans et plus. Et on voit ici qu'on a augmenté à peu près de 6 000 au niveau de deuxième dose pendant la semaine passée. On est à 70 % pour les personnes de 18 ans et plus, mais on approche 68 % pour 12 ans et plus. Je vais vous montrer celle-là ici. On a les doses ciblées. Vous voyez, on a 80 % de la population. Et les deux doses ciblées sont les doses du gouvernement pour qu'on puisse sortir et passe au-delà de l'étape 3. Donc, on est presque là avec la première dose. On est à peine, il manque 170 personnes vaccinées. Donc on va le faire dans quelques jours. On est un peu plus loin avec la deuxième dose. Vous voyez, on est à 68 % à peu près. Et donc, il manque à peu près 13 000 doses. Je pense que cette semaine, on va approcher le 70 %. La semaine prochaine, on va arriver le 75 %. Donc, on va pas, la province n'est pas là non plus. Non, on ne va pas rentrer, on ne va pas sortir de l'étape 3 cette semaine. Ça va prendre une autre semaine au moins. Donc, c'est une chose à suivre. Donc, on encourage les personnes. Vous voyez, on a à peu près 20 000 ou plus de personnes qui n'ont pas encore reçu la deuxième dose. Donc, on fait tout ce qu'on peut pour les faire venir se faire vacciner. Ça, c'est très important. Il faut dire aussi qu'au niveau de les doses ciblées sont ciblées pour qu'on puisse voir au-delà de l'étape 3. Elles ne sont pas vraiment pour l'épidémiologie. Nous, on voudrait être avec le Delta, on voudrait être à 85-90 %. Donc, on va aller chercher les 10 % difficiles. On appelle ça le last mile, la dernière mille, si vous voulez, pour qu'on puisse aller chercher cette population pour qu'on puisse rendre à 90 % parce que c'est avec ce taux-là qu'on va avoir une bonne protection communautaire contre le Delta qui se propage. Le taux de transmission est beaucoup plus élevé que la forme initiale du virus. Donc, je pense qu'avec tout ça, puis on va augmenter le débit. On espère que tout le monde, si vous avez hésité de prendre votre première dose, allez le faire. C'est facile. C'est disponible aux pharmacies, c'est disponible à tous nos cliniques sans rendez-vous. On a des cliniques mobiles, on va aller aux écoles, on va aller au commerce. On a pas mal de plans pour le faire, pour enlever les barrières, soit pour la première dose ou la deuxième dose. Parce qu'avec tout ça, on va rentrer dans une période d'automne avec beaucoup plus normal, pas à 100% normal, beaucoup plus proche que normal que jamais pendant la pandémie. Donc, ça, c'est une très bonne chose, et incluant la rentrée à l'école. Et aujourd'hui, le ministère a fait on a dans mes mains ici les guidances pour le rentrée d'école et en effet, ça marche comme on n'a pas de vaccin, on n'a pas vacciné tout le monde pour qu'on puisse toutes les précautions sont en place, dépistage, lavage des mains, hygiène, etc. Masque pour les premières années jusqu'à 12e année, masque dans l'autobus, etc. Masque et protection des yeux pour tous les professeurs et le personnel aux écoles. Mais rentrer à l'école 5 jours par semaine semaine, 5 heures par jour au niveau d'enseignement, physique, activité physique, toutes les activités normales avec des cohortes, avec différents types de restrictions. Masques non obligatoires à l'extérieur, sport pourront continuer pour aller manger dans une cafétéria, etc. Tous sont là, mais moi, qu'est-ce que j'aime avec ça, c'est qu'il y a plusieurs tranches, si vous voulez, des protections qui commencent avec le dépistage, avec l'hygiène, avec les masques, avec lavage, avec la ventilation qui est importante aussi, tout ça, et aussi avec la vaccination. N'oubliez pas que au secondaire, j'espère qu'il va y avoir un taux de vaccination chez les étudiantes et chez les personnels d'école élevé. Donc ça va être une bonne chose, une autre tranche de protection directe. Et chez les écoles élémentaires, il va y avoir une tranche de protection indirecte en dessus les autres tranches de protection, soit le vaccin, un haut taux de vaccination chez les professeurs dans les écoles élémentaires. Donc, les enfants qui sont en bas de 12 ans ne sont pas encore éligibles pour le vaccin. Donc, tout ça pour dire que je pense que on va avoir une bonne entrée à l'école. On va travailler. On a 12 infirmières qui vont de l'école, des écoles, du bureau de santé, qui vont travailler avec nos 4 commissions scolaires pour qu'on puisse faciliter leur entrée, répondre aux questions. Il faut dire aussi que tout ça va être réévalué dépendant si on a une 4e vague, si on a d'autres déflambés, etc., le taux d'infection, tout ça, on va le réévaluer, en effet, et au besoin, peut-être, on va retirer des précautions, mais ça c'est à suivre. Ça doit être réévalué de façon régulière. Aussi, ça se peut qu'on rajoute des restrictions de façon locale par le bureau de santé local pour qu'on puisse adresser si on a des flambées ou des choses qui ne sont pas contrôlées au niveau des infections, etc. Donc, tout ça est à suivre, mais je pense qu'on va avoir une assez bonne entrée, beaucoup plus normale qu'on avait l'année passée. Et je pense aussi que avec l'arrivée de la capacité de vacciner les enfants 5 ans et plus, ça va beaucoup plus faciliter les écoles et vraiment il va offrir une protection directe aux enfants qui actuellement ne sont pas capables d'être vaccinés à cause de son âge. So I'm going to answer some questions here. I've got a question here from CBC. Do I have any concerns about door-to-door canvassing or political rallies during the election? Well, I'd be the same concerns about anything else depending on our guidelines. Stage 3 or beyond stage 3, I would just recommend the same guidelines that we do for any other activity, obviously, respecting the guidance of the time, if it's during step 3 or beyond step 3 and so on. And obviously, I would expect that because you don't know vaccination status, that whoever canvasses should be wearing masks and should be avoiding others because you don't know each other's vaccination status. And I got a question about the new return to school plan, and I think I talked about that. So the question here is, what do you think will be the threshold to send your child for a COVID test in September? I think we're going to go back to a 2-symptom rule. I think we're going to be ruling nasal symptoms are not going to be included. It'll be more fever, cough, and shortness of breath. If I'm not mistaken, but they're going to be reevaluated. So there are going to be less stringent testing requirements. There'll be some tolerance of some symptoms. Again, that'll all depend on vaccination status and so on, of both the percentage of the school and the child and/or contacts, how we handle that. And will the household have to self-isolate until the test results are known? Again, this depends on the actual status of the family itself in terms of vaccination status. There will be separate outbreak management guidelines shortly, and we will have more details on specifics as they come out. I suspect they will come out within the next couple of days. I have a question here about, does the EOHU have any of the Moderna vaccines in stock that are reportedly set to expire this week? I want to clarify that. We receive Moderna frozen, and it has a long expiry date on it. I want to clarify. What happens is once you thaw it out, then it's good for 30 days. Once you pierce it, then it's good for a couple 24 hours for Moderna and 6 hours for Pfizer. So what's happening now is some pharmacies have had it thawed out, and the 30-day period is approaching. We don't have that many in our area. We don't do that at our health unit because we have everything frozen, and we thaw it out as needed, and we have many clinics. We're working with our pharmacy, so we don't have any wastage in that regard, and we're looking at our pharmacies to see what's left, and we'll use it. If they can't use it, we'll use it in our clinics as well because we're using it moving forward. Now that Ontario has announced post-stage 3 regulations, when can we expect more information from the EOHU on local measures, Section 22? Again, we're reevaluating them. I've already rescinded some, and we're already going to be, again, reviewing them all. My staff are reviewing those, and we're rescinding as necessary. What is the EOHU hoping to see in the Ontario school reopening plan, which announced? Well, I think I covered that. And presuming no recent cases have been vaccinated, yes. Yeah, the question is are we going to be posting vaccination status of those? We will. It's just a matter of getting it together, or we're going to look at how we're going to be reporting that in terms of, I think it's important, and I also asked the ministry that, and apparently there will be also daily reporting of percentage of cases that were vaccinated versus not vaccinated during the day-to-day report from Ontario as well. So yes, I think that's important. And like I said, from our point of view, all of the cases that we've had literally over the last 3 or 4 weeks have not been vaccinated. I'll correct it. One was vaccinated, but exposed within a couple of days of the vaccination. So to me, that's considered unvaccinated. And that's it, Jenna. We can get some questions.
Thank you, Dr. Paul. Notre première question vient de Émilie Bergeron, Radio-Canada. C'est à vous.
Oui, bonjour docteur. Vous avez déjà réagi là, au plan de rentrée scolaire, mais je voulais savoir, c'est pas prévu que les groupes soient réduits. Est-ce que ça vous inquiète? Puis est-ce que ça pourrait être revu là, en cours de route?
Oui, écoutez, actuellement, on dit d'avoir les cohortes, les groupes dans les classes qui ne mêlent pas avec les autres. Dans les classes, ils portent des masques, etc. Qu'est-ce qu'il faut? On va réévaluer, mais je pense qu'avec tous les autres, n'oubliez pas que le distance physique est une tranche de tous les autres tranches qu'on a ensemble. Mais c'est une chose sûrement à réévaluer. Le fait qu'il va y avoir des cohortes ensemble, un groupe unique en tout temps, me soulage un peu. De notre côté, on va toujours le réévaluer et agir si on a besoin.
Je me permettrais aussi de vous demander, pour les enseignants, avez-vous une inquiétude qu'il n'y ait pas assez d'enseignants qui sont vaccinés? Est-ce que vous pensez qu'il y a beaucoup de travail à faire, qu'il reste là-dessus?
Oui, en effet, ça m'inquiète. J'espère qu'on a un taux important élevé parce que, et qu'est-ce que nous avons demandé au comité scolaire de nous donner le pourcentage des personnels vaccinés ou pas. Et ceci va influencer, si vous voulez, ça va changer l'approche avec une flambée à l'école. Disons qu'on a un taux de pourcentage qui est très bas, on va réagir de façon différente que si on avait un taux de pourcentage élevé. Oui, j'espère qu'on a un taux important, assez élevé, parce que ça va vraiment faciliter des choses et surtout pour les enfants qui ne sont pas capables d'être vaccinés, des enfants en école élémentaire. Je vois le pourcentage élevé des personnels vaccinés comme une protection indirecte qui rajoute à tous les autres tranches de protection déjà en place.
Next question, Chris Rands, CBC. Please go ahead.
Hi, Dr. Roumeliotis. Can you hear me okay there?
Yes, I can.
Great. Thank you for asking the election questions. I just wanted to follow on one more thing, because let's pretend an election is called in the next week and a half. This would put election day into near the end of September, during which Premier Ford could go beyond the stage 3 into full reopening. So I'm just trying to get an idea what, other than being masked, going door-to-door canvassing, once we go beyond stage 3, we're basically in an election campaign that looks like 2019. That we have large rallies, we have people gathering together, we have campaign offices full of people, we have driving older or mobility limited people to the polls. It basically looks the same in my mind. Am I correct in that?
Except that they'll be masked when they're indoors. I think I lost you there. You froze.
Sorry.
You are correct. When I'm looking at the regulations and I'm looking at what is not there, most of that is not there. The only thing that's there is masking. And so that's going to stay. Even beyond stage 3, the regulation states it very clearly, and that will clearly apply to those situations. Now, if it's an outdoor rally and people can't physically distance and they're crowded, I would hope that we can recommend masking. But I think that the masking will be what we'll need to do, because we don't know the vaccination status of everybody. And that's why I was very happy to see in the regulation, it's actually in there. The date of, step 3 is not in, coming out is not in there, but that is in there. So to me, that would be the only kind of thing that's, left. Obviously, people should continue to, not go when they're sick, and be symptomatic and those type of things. But in general, I do believe that the masking will have to be there. And that's why we were very happy to hear that they were going to continue that.
And the other thing is long-term care homes. Any concern about people campaigning around the long-term in lobbies of long-term care homes?
They would have to adhere to what there's not open. It's not open season in long-term care. There are still some restrictions, and they would have to adhere to those as well. I would be more cautious with those individuals because they're more vulnerable, and so I would think that there would be more measures in place and more restrictions, which would be a visitor's policy as well. Okay.
Do those joining by phone have questions? Press *6 to unmute. Ceux qui se joignent par téléphone ont-ils des questions? Appuyez les touches étoile 6 pour désactiver le mode silencieux. Those are all the questions for today, Dr. Paul.
Thank you, everyone. Merci.